Brilliant. Thank you, Melissa. So welcome back, everyone, to the final part of the Royal College of Nursing Children and Young People's Nursing Conference. So we're now at the point of our Q&A panel. So the title of this is How Do We Prepare for and Address the Repercussions of COVID-19 on Children's Health? And it's an absolute privilege to have our three speakers in the room, and I really do hope that Rachael will be able to join us during this session. So first of all, Professor Bernie Carter, Director of Children's Nursing Research at Alder Children's NHS Foundation Trust and President of the Association of British Paediatric Nurses. And Bernie is one of our best known and most well-loved researchers in children's nursing. So welcome, Bernie. Everyone in the audience, I'm sure, has read one of your papers, if not all of them. Dr. John Alexander, Paediatric Intensive Care and Respiratory Consultant at University Hospitals North Midlands NHS Trust. And John, alongside people from the RCPCH, NHSI and RCN, forum members from the Children's Forums, is key in implementing the system-wide paediatric observations tracking SPOT program, which I'm sure he does in his spare time, because he's so busy being a consultant as well. And finally, Rachael Bolland, nurse consultant, acute paediatrics, St George's NHS Trust, whose role encompasses research, education, training, and staff development. Part of her key role at the moment is service development and how we meet the challenges of delivering an NHS fit for the 21st century. And she's currently focusing on how we develop nursing roles. So as we explained earlier, this is a Q&A session. I've got a few questions that have been posed earlier. And if you wish to ask a question, please use the Q&A function and type your question in, or the mechanism for putting up your hand, and we'll invite you to speak live to the panel. So the first question to all of you is, we have heard some of the challenges posed by COVID pandemic. Are there any positives that we can consider? And I wonder, John, if you would like to start with that question.
Yep, thank you very much, Dave, and thank you very much to the college for inviting me to share some of my experiences. I think as we come out of this pandemic, we are considering all the problems that we have to face, because effectively we pretty much shut down shop for about a year, didn't we? And it is easy to focus on all the challenges and the difficulties. But I think perhaps we should take a bit of time to think about what we've gained and what we've learned and what we can use from this experience for the future. I think the first and most important thing, I think, for the whole of the NHS, particularly for paediatric staff, we can really be proud of the way the NHS came together to deal with a very, very serious situation. And all members of staff contributed. We had paediatric nurses going and looking after critically ill adults. We had paediatric doctors looking after patients in the adult intensive care unit. And so, I mean, in some cases it was stressful, and some of us found it difficult, dealing with adults, dealing with a disease that nobody knew about, and also dealing with fairly high mortality rate. On my pediatric intensive care unit, we converted twice to an adult intensive care unit, and we looked after ventilated adults very, very ill with COVID-19. And we surveyed our staff afterwards and asked them, how did you feel about it? And a lot of our nursing staff were nervous when they started. But one good thing, and one thing that I think perhaps we should think about, is we stayed together as a team. We stayed on the PICU with the PICU doctors and the PICU nurses with some support from the adults. And by the end of the time, people actually felt confident and felt that proud that they were able to contribute. And I think that's something that we should always keep in mind, that sometimes you don't think about how proud you should be about what you have done and what you've contributed. The other thing that we've also learned is that the NHS can be slow at times. It can be, really glacially slow to get things done. But in a big emergency like that, we did turn things around very quickly. And again, in my example, we changed from a pediatric ICU to an adult ICU within 1 week the first time around, and the second time around within 24 hours. Monday we said we'll take adults. Tuesday the first adults came in, and we've learned how to rapidly change situation. I think this will be very, very important as we face some of the challenges in the future. I think this conference and the use of the technology has been a really amazing revelation. We've all been thinking about it and toying around on the outskirts of technology, but just because of a necessity, we've moved into different remote meetings, so at a conference like this,
I think we've lost John mid sentence there. You're back, John.
Okay, and, it's not as good as meeting people face to face and net.
No, I think we've lost John again for a second. I think one of the points that John was making was about how the NHS as a whole has stepped up to the care of patients in COVID, but I think especially the way that children's nurses and medical teams, etc., in PICUs and across other parts of the NHS have really stood up and contributed to the huge effort that's gone on. And I'm sure everyone in the room would say a big thank you to everyone that's done that, and a big thank you to yourselves as well.
Can you not see me still?
You're back in the room, John.
Good.
Brilliant.
Do you want me to keep going?
Yep.
A couple of things is that obviously we've reduced our carbon footprint. Remote consultations, have their disadvantages, but there have been advantages. My DNA rate in my clinic is now significantly low, and some of our emergency processes have become a lot more agile. So these are big things to take forward for the future.
Yeah, thank you, John. That's fantastic. And Rachel, welcome. I think we can hear you.
Thank you. The appliance of science. I should have stayed at work where I had children that would help me to log on. So
fantastic,
apologies everyone, but I'm here now.
Welcome, and hopefully I gave you a fitting introduction at the beginning, even if you didn't hear it. I don't know, Bernie, if you've got anything to add to that question about what are the challenges posed by the pandemic, and whether or not there are any positives we need to consider.
Sort of broadly speaking, I think John's picked up a lot of the benefits. I think it's made people actually think about the NHS and the value that the NHS has. And I don't think we should be sort of trying to perceive ourselves or perceive children's nurses as kind of heroes or anything like that, because we're really super skilled people who are just as frightened and just as worried and have got as many personal concerns about the pandemic as everybody else. What has just impressed me is how much people have looked after each other, how important that's been. And I hope that sense of kindness, which I think has always been there in children's nursing and in child health care, continues, because that bond and that looking after people is something that's really important, because the pressures on the NHS and the pressures on people with a children's nursing qualification working in other areas are going to continue to be difficult post-pandemic. And I'm going to raise a cheer for all of those people that don't often get a mention, who are the lecturers and people working in the universities who've helped mobilise students to come into practice, to support practice. They've mobilised themselves, they've gone in and become seconded and helped out and signed up to do vaccinations. So I think that sense of community is really, really strong now, and I hope that continues. And I think as well for children, it's given, and children and families, it's created opportunities for new ways of engaging with us. Not all of it good, not all of it great, but things to pick up on.
Brilliant, thanks, Bernie. Rachel, I don't know if you've got anything to add to that question response before we move on.
I think COVID has actually allowed us, I think, as John's already covered, to really innovate. But I think what we also need to make sure is that, does it actually work for children and young people? So how are we involving them in service design? So one of the things I've really enjoyed is setting up our Children and Young People's Council. And actually COVID enabled us to do that because they weren't at school. They weren't allowed to go out with their friends. So we were able to engage with them online to get their views about what was happening. And I'm really looking forward to working with them going forward to make sure that their voice is heard, so that we both see them and we hear them and we find out what really works for them and what they like as well.
Fantastic. Thank you, Rachel. Bernie, we've got a question around research, which I'll ask you to start off with. So what are the repercussions on research involving children and their families?
I think that, again, I think with everything, there are some good things and some bad things. I think one of the things that happened very early on in the pandemic was there was a big review of what was deemed to be critical or important research. And a lot of the research that perhaps was focusing on children's experiences and children's views was not deemed to be that urgent or that important in the light of needing to mobilise resources for COVID-related research. So although I can absolutely understand that, and I would never have sort of argued against that, I think we've now got a tail of research that we're now behind with. And I think it's always been quite difficult to prioritise children's research against some of the other priorities that exist. I think the other thing that's happened is that the pandemic has actually demonstrated that research can be agile, research can be, we can consider research in a really robust and a really strong way, and some of the bureaucracy and some of the challenges that can put people off doing research can be overcome. And I hope we take some of the lessons from the streamlined approach to approving studies into the future, because there's an awful lot of time that is wasted on some of the unnecessary components or the unnecessary difficult components. I think for me, where there was sadness with some research nurses either losing their jobs or being redeployed into other areas, because many research nurses are employed on kind of short-term, fixed-term contracts. We're at the process now where we're beginning to restart studies, and that's proving to be quite complicated as there's such a backlog. Things like funding opportunities were suspended. Everything has been, much of it has been on hold for quite a lot of research over the last year. I'm hoping that what will happen is when everything gets back up to speed, we're going to have kind of a sleeker, stronger and more able set of systems. However, there have been some good things that have come through. For those of us that have been researching for a long time, we've been arguing that there is potential for research to be done remotely, for us to be able to engage with children using remote methods. And there was always a resistance against that. With the pandemic happening and the obvious ability for secure teleconsultations to happen, that kind of has led the way for us to be able to do more remote work, which is both helpful for us in terms of keeping the costs down of research, but also means that children are not, they have perhaps a stranger, the researcher comes into their room via a screen, but you're not actually sort of necessarily having to go into their house or their home. And I think that can actually be good, and children have got a lot of control over the tablets or the computer that they're actually using. We've done some really engaging research with children during the pandemic. We've done consultation where children have sent us their drawings. We've then worked with an artist who's managed to incorporate that drawing into an illustration that he's added to live. And he's managed to animate the children's drawings in the middle of a Zoom meeting, which was something that was a bit of we weren't entirely sure if it was going to happen. But the level of interaction that we got with children remotely was as good as when I've been working with children directly in kind of the same room as them. I think there's been lots of benefits in as much as we've managed to, as researchers, we've managed to meet more easily. We're not having to sort of find the time to sort of drive places. So I think that side of things has been good. We still don't know what some of the challenge, whether or not some of the ways of working that we've adopted are good or bad. We think they're good. They've not been fully evaluated. We know that remote engagement can work for some children and for some families. We know that if they've only got one computer and it's in one room, there's privacy issues in terms of doing interviews with a child if other people will be overhearing them. We know that some children may not like the technology, and we know that some families won't have good access to good Wi-Fi. And you only have to look at how stressed Rachael was when her connection wasn't happening. Trying to do an interview after you've had a stressful sort of means of trying to engage somebody will not give you the same sort of data or quality of data that perhaps you would otherwise. I think what next? I know research isn't always the top of everybody's priorities, but without research, we can't have informed ways of engaging with children, of practicing with children. So I think we all need to become advocates for children's research. And I think all of the topics that existed pre-pandemic are still topics of importance, but we've now got a whole range of other topics that we are going to need to address, and not least of those, things to do with friendship, loneliness, connection, and the issues for mental health. Because I think the pandemic we're going to see a long impact on children from the pandemic. I know from some of the children that I'm working with as a researcher, they've not had physiotherapy services for such a long time that we've almost got research studies about what happens when there is a loss of service provision to children, and whether or not that has a long-term impact on their rehabilitation and their development. So a whole range of different things, and I will stop now and hand back to Dave.
Thanks, Bernie. There's a huge amount of issues that you've talked about there as well. I wonder, John and Rachael, whether you want to comment on the matter of research and the impact of COVID.
I'll just one point is that clearly, as we're trying to get back into research and trying to reopen our research, we are fighting against the continuing COVID research, and the priorities, where currently the main priority is to continue the COVID research, which is absolutely essential. We need to keep doing that work, but we, as Bernie said, we do need to get our children's research back up and running again. So that's a bit of a battle that we have to keep working on.
I think we also need to look at how audit links with research and things as well. So I think, in an acute setting, there's lots of data that we can collect. There's studies that we can do looking at, as Bernie said, do virtual clinics work for people? Does socioeconomic background impact on it? Have we actually asked the children and young people, does it work for them? Does it meet their privacy and dignity and confidentiality needs? And are we actually capturing outcome data? So how many children are presenting late to hospital in a much more severe condition, whether that's cancer, surgical conditions, and also how long is it them actually taking to get treatment, and what impact does that have on them? I know, for example, food challenges, massive delay on those. Children didn't want to come into hospital, but what impact does that have, particularly if that's a younger child and you're trying to develop their eating skills and things as well. So I think there's lots of things we can do in all the different settings, and we've all got a role to play in that, and to really help the researchers access various different groups. And the hard to access groups, it's sometimes us that don't know how to access them rather than being hard to access.
So absolutely. Yeah, thank you, everybody. So we've got some questions from the audience. We've got a question and a comment from Jeanette Hawkins. So Jeanette says, around the UK, children and young people with chronic conditions who visit hospitals a lot are becoming traumatized by repetitive nose and throat swabs. Hospital policy varies. Would lamp saliva tests, and I'm afraid I have no knowledge of that at all myself, would those be an alternative? And I suppose there's a wider question there about the testing program for children in schooling as well, and the trauma of irregular testing. Certainly, you know, I test twice a week because I'm traveling to campus a couple of times a week, and generally as a good citizen. And it isn't the most pleasant experience ever for an adult either. So I wondered if any of you have any comments on that matter. Would anyone like to go first? I think John?
Oh, go for it, John.
This really is a problem. Unfortunately, I have the role of being the COVID meister in my department, and so these questions come to me. You know, somebody comes in every month for blood transfusion, so somebody comes in for some form of infusion. We have to keep swabbing them, and the balance is we need to protect our staff. We really must protect our staff from getting infected. Clearly, as more and more of the staff become vaccinated, you know, that is a good thing. The problem is that vaccination doesn't guarantee you don't get the infection. It means that you may not get the severe infection. So we still have a duty, unfortunately, to protect our staff. At the same time, I really feel bad when I have to say that somebody has to come in every month and have a swab done. And sometimes we try and work out other pathways. So we say, okay, if you don't have a swab, but you can come straight into a cubicle and everybody wears PPE and manages it that way. And so there are ways around it, and it may be that we will change the PHE guidelines if the local infection level comes down further enough. But the primary thing always is that we have to make sure our staff remain safe.
I think we know the impact of things like blood tests and the trauma that can have with children. So I think what we have to see this as another potentially traumatic procedure for children. It's routine because it has to, you know, potentially has to be done. But I think what we have to do is put good, encompassing, supportive care around that child and think that actually this is something that will be repeated and has been repeated. So I think by the time some of the children come to hospital, they've already been swabbed that many times that it is just a really difficult experience. And I think this will be one of the many mental health and well-being issues that we take with us into the future with children who will be resistant or worried or frightened or whatever. So I think that's where really good, skilled nursing care will come into ensuring that we make those make the screening as positive an experience as it can be, and take it as something that isn't a routine thing.
Thanks, Bernie. There's comments in the chat from Catherine Manlow. Catherine, you are welcome to come and speak if you want to. But Catherine says we have buccal swabs available as an alternative if it's too distressing for children. So there are some alternatives out there, which is fantastic. Moving on with the questions, Marguerite Kuzma says, hi, as a school nurse, I'm interested to hear what some of the expected issues or concerns that we should be aware of. Mental health has been a big topic of concern. Are there any others? And are there any ideas about how we can support children, young people and families to recover and build resilience? Rachael.
Yeah, so I think, you know, in the acute setting, we are seeing an increase in the number of children admitted with mental health issues, but also issues that are functional, that may be related to anxiety. So I think we've really got to, I think schools are going to be really important in this, in how we address mental health issues in children and young people. And we've really got to talk about it more with them. We've really got to ask them, how are you? Are you okay? And to not keep nagging them about it, but to actually actively listen and hear what they've got to say. I think it's really important that we treat them as individuals and that people react differently to adverse childhood experiences. So if people haven't watched Jean Davis's video talk yet on trauma-informed care, I'd really recommend that. It's excellent. And it looks at what are those factors that make children and young people more vulnerable, and then how can we help them? And there's also a really good free e-learning module on Future Learn, which is on COVID-19 psychological first aid. So I'd really recommend that if you haven't done either of those. And then I think we've got to really signpost children and young people to really good online resources. They like to tap the app, they like online things, but actually there's some really destructive, negative websites out there. So I think we all agree we're seeing more children and young people with eating disorders. So it's pointing them in the direction of things like Beat, which is a really good resource, and can really support parents as well, but can support schools. I think there's things like bullying's been an issue. So we've seen children that have self-harmed due to bullying. And actually it's much more severe, the level of harm that they're doing to themselves than what we've seen previously. So there's things like the Anti-Bullying Alliance, but there's also schools having an active anti-bullying policy as well, and looking at how they pick that up. So we really need integrated services. There's things like Shout that they can access, which is a crisis helpline, so they can talk to somebody. And then I think we've really got to get our public health messaging right. So there's been a lot of talk about healthy eating, nutrition, exercising, and we know from the evidence that that doesn't necessarily help obesity levels, but what it does do is it actually increases the level of eating disorders, and it really feeds into that. So I think we really have to advocate for children and young people around that. And then I think we've got to think about the children and young people that do end up being admitted to hospital. So again, I'd really say if you haven't watched the video yet, yourstance.org, that's around the knife crime, listen to that, because I think we're all exhausted, no matter what setting we're working in. We've all had the challenges of COVID, and there is the danger of compassion fatigue. But these children and young people are often very challenging when they're on the ward. And so we need to think about how we support them. So prior to COVID, we probably saw one young person every fortnight admitted with an eating disorder. As we were coming out of lockdown this time, on our 17-bedded paediatric medical ward, 11 of those beds were filled by children with an eating disorder who hadn't been able to access community services, or the services that were on offer just so overstretched they couldn't see them in a timely manner. And we need to remember that although they've got mental health issues, they've also got physiological issues. So it's not in the longer term the right environment for them, but in the shorter term, some of these children will need to be on an acute paediatric ward. And then that's got implications for all of us in whether we've got the skills and knowledge to look after them. And I know Dave and I were chatting the other day where we were preparing for this, about it's really got implications for nurse education. And we've got to support everybody who's looking after children and young people. So, you know, staff, as I say, feel emotionally drained. We're having to restrain young people on the wards, and we need to know how to do that safely. So I would say, you know, look at the resources that are out there. So MindEd is really good. There's the South Thames Paediatric Network has got a whole load of videos that it was done, which again I would recommend. It's on their YouTube channel. And there were 600 of us logged onto a day session that they did looking at challenges around mental health, but also around how it's triggered children that are on the autistic spectrum disorder and the impact that that has on their eating and other issues. And there are things like the Marzipan app, and Simon Chapman, who developed it, he's on Twitter, and it's Don't Forget Your Peas. So again, he's a really good one to visit. But I think, you know, it's not an easy fix. And I think we're going to see this for a long time. And so we really need to think about how we look at our environment. And that's in the school environment to keep young people safe, but also in the hospital environment, undertaking risk assessments to make sure that young people are safe. So I've kind of gone on there a bit, but I think it's something that we all feel passionate about. And it's something that's challenging all of us, regardless of what setting that we're actually working in.
Thanks, Rachel. That was fantastic, and what a huge amount of resources you have right at your fingertips. And I think part of what you've demonstrated there is one of the benefits of COVID is the access to resources, the access to events, whether they're free or paid, that you can just drop into and then have recorded material from afterwards. And again, thank you for promoting the recorded material that we've got as part of this conference as well. John and Bernie, I don't know if you have any response to that question at all.
briefly, I think everybody has come out of the pandemic differently, physically tired, mentally tired, kind of however resilient we might be, we're not quite as bouncy as we were before. And I would just like people to be able to, children and families and everybody, to take a breath and not expect too much of themselves, because it's going to take time for people to actually start to return to a point at which they feel that they can build resilience. That doesn't mean to say that we shouldn't be building resilience in children, but I think it can sometimes be, and absolutely not in the way that Rachel was talking about it, but politicians can say, well, we just need to build resilience, and actually what we need are resources that will support people so that they can become resilient. We need services that are there for them to support them when they need it, and we need kind of like a compassionate look at what we're expecting of our children and young people, so that children starting, young children starting school won't have socialized anywhere near as much as they would have been before. So there's going to be all sorts of issues. And I think we shouldn't be looking at things too much as issues. We should be looking at things as, this is what one would expect when an entire country and the world has gone through what we've gone through. But I think it's a really good time to start to advocate for more services for children, specifically within the community, because that's where I think a lot of really important work can be done. That means that children won't actually end up needing to go into tertiary services or secondary services.
Thanks, Bernie. There's a few comments in the chat as well. So Lara Parker, I work in a school, and mental health repercussions of COVID and lockdown are huge increases in anxiety and CAMS and lack of services to deal with it. For those of you who haven't seen, Bernie has replied to say that Bernie and Prof Lucy Bray will shortly have some standards and advice and procedures out for holding children and young people. And there's a request there for you, Rachel, for you to post some of those resources in there if you can have a chance at some point as well. That would be fantastic. And we do have some more questions. We've got a question from Lucy Parker. Given the huge changes to acute care pathways for children and young people during COVID-19, how do you think we can ensure access to acute care to avoid delays?
Shall I try and answer that? I think there are two things to think about. And I think there is the fact that a lot of pediatric departments have had their footprint changed quite a lot. A lot of people have lost part of their departments, their assessment units or the acute admission units, while the hospitals have all rearranged themselves to cope with the COVID influx of mainly adults. So trying to regain that is actually being a challenge, and many hospitals are still struggling to get back their original footprint. Some people's outpatients are now assessment units, etc., etc. And to a certain extent, if you don't have the space, then you don't have the capacity to do the acute work, and that's really something to think about. I think the one issue that I don't know if we'll have time to talk about is children needing surgery. Almost all of pediatric surgery was shut down for the whole of the pandemic period. We need to try and recover that, and that's a big challenge as well. And the problem is, of course, the acute problems are there, and there's the backlog of the ones that we haven't dealt with. So, and we have the same number of doctors and the same number of nurses. So it is a big problem to think about. I think in the end, we'll have to think of some form of local network solutions to try and use as much of our resources that we have locally within our local towns and things, and then within region to see how we can address some of these challenges.
And I think it's also thinking about the challenges that we're currently thinking we're going to face. So we know that in our area, we need to up our surgery to 120% to play catch up, at the same time as seeing an increased number of children with health issues who require help and support. And we've got a bronchiolitis surge and respiratory issues on the horizon, and that we're expecting that bronchiolitis surge much earlier this year. So that is going to put a real pressure on our beds. So I think we've got to be really clear about what our pathways are, and looking at, as John has said, how we network with other areas. And also, you know, during the pandemic, we made use of the private sector. So I think those are some of the questions we have to ask again about where are the resources that we can use. And we as children's nurses and doctors and teachers need to really advocate for children and young people to make sure their voice is heard. And there was an excellent letter that the RCPCH president and retiring president wrote in the Times, really pleading to the government to listen to children and young people, that during the pandemic they've been seen but they hadn't been heard. And I think it's part our responsibility to really make sure that their voices get heard this time.
Thanks, Rachel. Bernie, if you want to come in there.
Yeah, just briefly, I think we need to be thinking differently and using more innovative approaches. So we know for some work that I'm doing with Helen Hartley at Alder, we're looking at whether or not rehabilitation can be supported using virtual reality gaming for children. So I think rather than thinking we have to always have the children coming into our settings and we will be doing stuff to them or with them, I think we need to think about, are there other ways in which we can deliver the same outcomes, but not necessarily using services in the same way. So it's not necessarily going to be a quick or an easy win, but I think the pandemic has taught us one thing, that we can't think on track lines. We have to think in different ways. And it's also demonstrated how fast we can start to think and apply different ways of working. So I'm hoping that that will happen, because there are many of the children, especially children with long-term conditions, can perhaps be managed. Some of them, we haven't got the evidence yet, but can perhaps be managed effectively from a distance. And it may be more suitable for them because they're not missing school by having to come to the hospital. They'll be able to engage more. I mean, John was saying that he's got, much lower non-attendance rate. It's kind of finding out whether or not reassurance calls and sort of specific video consultations can actually work. And it's working out how we can make best use of the space and the time that we have got, without forcing all children to sort of do the thing that we think is the most efficient, because it's still got to be the best. Always, we've got to have the best interests of the child and their family. So I think we need to start thinking of different ways of working that are not necessarily hospital-based or GP-based, and use the resources that are available.
Yeah, thanks, Bernie. And I think one of the challenges for those of us in education around that is around very quickly across all of our professions learning to do that really effectively, because not only will it be a future part of our service and the care that we give to people, but it will also be part of the training and placement circuit as well. And we have to think quickly about what are the key skills that our students as well as our staff need to develop in the NHS. And also, how do we educate our practitioners and our students to be aware of things they may see, for example, in children's homes and people's homes, that might cause them concern, and what to do about that. For example, if in the background you see a safeguarding incident going on while you're talking to a child doing research or doing a consultation, etc. We're coming to the end of the session today. Just a quick shout out for Katie Anderson, who in the chat has said, I've collated a number of educational podcasts which may also support staff, students and children and young people. You can find the list via my Twitter, so at Katie Anderson 5, if you want to go and see that as a resource. And thank you, Rachel, for the long list of resources that you've managed to post there as well. That is just fantastic and just shows you know, how easy it is to have those at your fingertips ready for when you're speaking with families and our staff as well. And Mary Brady says she's written a paper which is due for publication shortly regarding how we as educators can enhance student nurse knowledge and confidence in caring for children and young people with mental health issues. Mary, if you're able to, could you type in the journal there that's going to appear in, and then people can put out a lookout for it. So thank you, everyone. We've got 118 people still here listening to us, which is just fantastic. For everyone who's attended the conference today, has been able to put aside half a day to reflect, to listen, to learn, and to take care of themselves as well, because part of coming to a conference like this today is about us all taking care of us, of our own mental health, our own well-being, our own education, and being able to see people and network, even if we're not in the grandeur of London and Cowdray Hall at RCN headquarters. So all that remains for me to say is to thank all of our speakers today and our esteemed panel, and all of you delegates for coming to the first collaborative RCN Forums Children and Young People's event. This is the first in some years, and I'm hoping that this has been such a resounding success that we will be able to continue this in the future. The video on demand sessions will be available to view on Hopin until, and that's what we're in, I think, until May 22. So please do come back and look at those sessions over the future. In a week's time, you'll receive an email with a new link to access today's live recordings. Oh dear, you get to see me again, stumbling over my words first thing in the morning. And the pre-recorded content on demand, which also includes John, who's here today. I have to give a shout out to John and his talk about the spot work, which is pre-recorded, along with all of the others that I mentioned earlier in the day, alongside sepsis, etc., and knife crime. And have your say. We value your feedback. Please do spend 5 minutes to complete the evaluation form. An email will be sent shortly along with a learning certificate for you to download for your NMC re-registration if you are an NMC registrant. Final shout out from Bernie in the chat. It'd be wonderful if all 118 people could write. Oh, it's gone now. It's moved too quickly. Write to MPs to ask them how they are supporting children's healthcare and reduce health inequalities. And for those of you like us in the Southwest who now have a regional mayor, I think the regional mayors are really great people to ask that question of as well, because each of them do have a manifesto, and it should include children and young people very clearly in that manifesto, as long as all of the other things that they're dealing with at a local level. And Chris, really good to see you too from Nursing Children and Young People. And thank you very much for coming and doing your workshop. So thank you, everyone. Really good to see you. Thank you to all our speakers, and hopefully see you at the next conference.
Thank you. Bye-bye.